Healthy Hampton Roads is sponsored by Bon Secours.
We're talking about anterior hip replacement with Dr. Anthony Carter from Bon Secours Orthopedic. So who might be a candidate for hip replacement?
Sure. The candidate for hip replacement is someone who has hip pain, primarily groin or thigh pain, sometimes buttock pain that's not responsive to conservative treatment. Typically the causes are osteoarthritis, rheumatoid arthritis, trauma, avascular necrosis, or some type of developmental dysplasia.
And what are the benefits of anterior hip replacement?
Sure. So the anterior hip replacement, the direct anterior hip replacement, is a tissue-sparing, muscle-sparing approach. So with traditional surgery, you have to cut through muscles and tendons to get there, which destabilizes and weakens the hip. By avoiding that, patients recover faster, they get out of the hospital quicker, they have less pain, and a quicker return to function.
If you have any more questions about hip replacement, you can get in touch with Dr. Carter at bonsecours.com.
Healthy Hampton Roads is sponsored by Bon Secours.